This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
I'm Harmon, and I'm a PGY4 at UCLA Greater Los Angeles VA PM&R program. I'm joined by one of my co-residents, David Underhill. I'll be going through the presentation, and we have quite a few slides to get through in these 20 minutes. So we welcome any questions in the chat as I go along, and David will be answering those and kind of monitoring that as we go. Okay, so an overview, we're going to go through who we are, some details about our rotations, skills that we feel confident performing by graduation, where our alumni have gone after graduation. We always get a lot of questions about where to live in Los Angeles, what our benefits look like, and just some pictures to give an insight of what life looks like at our program. So we are a diverse program with residents that have varying backgrounds and interests, and we enjoy hanging out outside of work. This is a photo of our most recent graduating class, along with 3s and 2s. We get together probably on a weekly basis to enjoy all that Los Angeles has to offer. We have some pictures here of some activities that we have all done together. So in the top right, having a picnic at the Getty Center, and the bottom right, trivia night. We have residents that are local to Los Angeles, but also from outside, coming from the East Coast or the South. A good mix of people that are single, engaged, married, parents or not parents, to either children or pets. A lot of athletic people. We have a group that likes to play pickleball together, a few that like to play golf, some self-taught DJs, semi-professional photographers, and a lot of food and coffee enthusiasts and everything in between. And a great mix of introverts and extroverts, but we all get along really well together. As a program, I think one of our greatest strengths is that we have a very friendly, approachable, compassionate faculty. We've got a great picture of them here from our most recent research day, and they're all very invested in teaching. So our rotations, we have a great mix of general clinic, which includes injection clinics and electrodiagnostics, and then specialized inpatient rotations in traumatic brain injury and spinal cord injury, and pediatric rehab. We've got a picture of Miad Haday getting his blink reflex tested, and then some of our alumni with Dr. Aragaki in the center. And then on the right is a picture of what the rotation in spinal cord injury at VA Long Beach looks like. We have an opportunity to trial some of the drivers' training equipment there. And this is an image of one of our primary sites, which is the West Los Angeles VA, which is located in Westwood. And here we do an acute rehabilitation unit rotation. You do 2 6-week rotations here. And it is a mix of stroke, amputee, and postoperative ortho and neurosurgical care. And it is a in-hospital rehab unit, not standalone. We have 2 really great attendings that we work with there, as well as a continuity clinic once a week that allows you to see previous ARU patients after they've been discharged. And we take home call while on ARU. It's usually a Monday through Sunday block or 7 days in a row, about every 4 weeks in your 6-week block. So in total, it'll be about 2 weeks. And this is a great preparation for attending life, because home call is pretty reflective of what working as an inpatient rehab doctor will look like. after residency. And weekend days are usually not a full work day. You'll round briefly with the on-call attending and handle any consults, but they're pretty brief. And then the outpatient clinic, we rotate through a few different clinics here. We do electrodiagnostics. We have great exposure pretty early on in our PGY2 and haven't had any issue getting our minimum 200 numbers. We also do general PM&R clinic, which is MSK, and we have a great referral base because PM&R has such a strong presence at the West LA VA. We get referrals from all of the surgical specialties, primary care, and we're pretty well respected and known within our institution. We also do chronic pain and interdisciplinary headache clinic, and that's something you'll get early exposure to as a PGY2. So while you're at the West LA clinic, you will do this 1.5 days per week, which is great early exposure if you're interested in pain management. We also do neurolysis and spasticity injections there. And overall, we have a really high volume of procedures. You'll get a couple hundred probably as PGY2s of doing joint injections, ultrasound guided and anatomic. And then when we go on to do fluoro pain rotations, you'll get to do neuraxial interventions and see some nerve blocks as well. Consults rotation, this is one that we'll do a little bit later on in residency when you're more senior. You'll see all the patients that receive a consult from the West LA VA to be admitted to the ARU, as well as cardiopulmonary consults specifically. So patients are usually in the cardiac ICU, and we're providing guidance on whether we recommend them proceeding to the next phase of their rehab program. And we also have an opportunity to rotate in a long COVID clinic. This is a picture of the Sepulveda VA or Sepulveda Ambulatory Care Center. Many will recognize this as the site of the early seasons of Grey's Anatomy. It was filmed at this location, and we get the opportunity to do outpatient rotations here. We get more electrodiagnostic exposure, but with different faculty, so that allows you to see or gain exposure to different styles and teaching methods. There's also a dedicated injection clinic, a half day a week, and you'll get a lot of opportunities to practice your ultrasound techniques, a general MSK clinic, and then also some rheumatology clinic exposure to help round out our learning. UCLA spine, we rotate here for our interventional spine exposure. So we have an image of the UCLA Santa Monica Hospital, the spine center specifically in the middle, and then Reagan on the right. The procedures are done in Santa Monica as well as Ronald Reagan, and you'll have opportunity to rotate through the clinic. And there's a really high volume of procedures done, and they really involve the residents here. And you'll get an opportunity to work pretty closely with the spine and pain fellows when you're on this rotation. And this is California Rehab Institute. This is one of our inpatient rehab locations located in Century City. It's actually very close to the Century City Mall, which is an amazing mall, and the site of Crazy Stupid Love, like shopping scene, if any of you have seen that. So California Rehab Institute's is the largest inpatient ARU on the West Coast. It is a private institution, and it's 138 beds roughly standalone. So it's a good supplement to our other inpatient units. You have a lot of medically complex patients here, primarily coming from UCLA and Cedars-Sinai, but we have great support with consultants here with internal medicine. We do in-house call here, but the shifts are 7 a.m. to 7 p.m. about 1 week at a time or 7 days in a row, and roughly 2 weeks during your 6-week block. In total, we rotate 3 6-week blocks here. And it is an exposure to a very different population, a patient population than we see at the VA. A lot of privately insured kind of VIP patient population. Rancho Los Amigos is a national rehab center. It's a county location, and we do our traumatic brain injury here. You might recognize the Rancho scale that was developed here. And it's a world famous rehab center. Really known or an infamous name out of there is Jacqueline Perry. And we work with two really great attendings here who are both TBI trained. And we get a lot of exposure to spasticity management here. A great thing is that food is also comped. You get free breakfast and lunch every day, and it's pretty nice facilities. This is a county population, so again, a nice round out from VA versus the private populations. We use a different EMR while we're here too, so that's great for future preparation. CHLA is where we do our pediatric rehab rotation, which is a top 10 peds hospital. And you get a pretty comprehensive experience here as well with TBI, spinal cord injury, ortho rehab. And the attendings, Dr. Craig, he is one of the leaders in pediatric rehab, and we get to work pretty closely with him.
Right. You have 4 minutes remaining.
Okay, in Long Beach, VA is where we do our spinal cord injury because they have one of the largest spinal cord injury centers within the VA system. And there's also a fellowship that's housed here in spinal cord injury. And this is a really robust didactics experience. And you get to see inpatient and outpatient exposures here. And here's some of like insight into what rotating there looks like. You'll spend a day in a wheelchair. And we can work pretty closely with Dr. Ng, who's a hand plastic surgeon with tendon transfers, and test out some other adaptive sports equipment. Just going to move on from there. Okay, so overall call schedule. So ARU, you'll do 4 weeks of call, consults 2 weeks, CHLA some weekend days, and Cal Rehab we mentioned 7 a.m. to 7 p.m. So overall, it's about 14 weekends over 3 years, so not a high call burden. And otherwise, we're working usually 8 a.m. to 4:30. So coming out of this program, we feel really comfortable managing patients at a really high level in the ARU because of our specific rotation sites, SCI and TBI, really strong injection exposure, as well as ultrasounds and electrodiagnostics, and we treat patients in a variety of settings and get to adapt to multiple EMRs. And a look into what our alumni have gone into. We have had a number of people match into pain fellowship, but also recently going into SCI, TBI, non-ACGME interventional spine, as well as NAS, and then going into general inpatient or outpatient PM&R jobs, both in California and out of state. We have an in-house PM&R ACGME accredited pain fellowship program with 5 spots. And we work really closely with the West Coast Sports Foundation for some sports medicine exposure. And there is a Harbor UCLA fellowship that's nearby. And we also have a PM&R spine medicine fellowship at UCLA with 3 spots. Our alumni network is very strong, and Dr. Aragaki carries a strong presence for us at national organizations. And so this has been really helpful for people looking into fellowships or word of mouth job opportunities. And speaking of Dr. Aragaki, she's an incredible PD and very, very supportive. And her name is kind of known throughout the country. So you'll often hear people ask you to say hi to her if you run into them on the job trail or fellowship interview path. Let's see. Okay, so just some downsides. You have to have a car if you're going to be living in Los Angeles and going to these different sites. But if you live in West LA, you will be against traffic. And most shifts do end by 5, so you're not coming home too late. We do have mandatory research, but it's an ACGME requirement. Our blocks are 6 weeks to 3 months. Some people don't like ones as short as 6 weeks, while others find the 3 months kind of fatiguing. And then our vacations are allocated in 1 week per quarter or 1 week per 12-week blocks. And
I'm sorry, you still have 5 more minutes.
Okay.
Mhm.
Some research. experience that our residents have done. So this is just a small snippet of some of the national posters that we have had recently. You have a month of elective, and you can use that for research or extra clinical opportunities. A lot of people choose to use it for further neurosurgery, orthosurgery, and radiology experience. And all of us together as PGY4s get to attend AAPM&R. And so that's approved as a senior resident. And it's a great kind of tradition that we have, but you can also be approved to attend as a junior if you're doing a poster presentation. And some of the volunteering experience opportunities that we have. So we have sports coverage with Team to Win, which I mentioned, which is very closely affiliated with UCLA Harbor and their sports medicine fellowship. We teach a lot of workshops for UCLA medical students. So if you enjoy teaching, that's a great opportunity. We have done EMG, NCS, ultrasound, and we also teach their MSK physical exam portion of MS1, because Dr. Pham is a strong presence in our PM&R program and the PD for the pain program. And she is MSK block chair for MS1s at UCLA David Geffen. But you also have the opportunity to teach outside medical students as they rotate through. We will see them at California Rehab Institute, Rancho, and the UCLA spine rotation. Our didactics, we have a 3-year curriculum that will go through the foundational knowledge, but also some portions where we get multiple passes. So anatomy, lecture series, you'll get multiple passes through all of the major body areas. And we also get an opportunity to do a cadaver session at UCLA. We have an EMG NCS lecture series catered for every level of your training, so both basic and advanced, and a great orthotics, bracing, prosthetics, gait rehab curriculum, as well as ultrasound, and the ultrasound one you will see every year. And you can't forget about the great weather and just like scenery and location of our program. So Los Angeles gives you an opportunity for year-round great weather and outdoor fun, which we definitely take advantage of. We often have social events at the beach or hiking. And we've got a picture of the pickleball crew that likes to get together. And as far as the cost of living in LA, so average for like a 1-bedroom, 1-bath is about $2,500 for West Los Angeles. And that's where if you live here, you'll probably be against traffic for most of your rotations. But we have residents that live all over, and price of rent can be high, but if you take into account our salary benefits and our housing stipend, it's pretty reasonable.
You have 2 minutes remaining.
Okay. Some other benefits that we have, so opportunities for educational dinners and didactics with pharmaceutical companies that may reach out to us, and things like cadaver injection courses, and they'll also provide us dinner. With our UCLA affiliation, we get access to an Uber Eats benefit, so you can order food to be delivered while you're at work, but also have $3,000 per year at the UCLA cafeteria, and our insurance is pretty great. And you also get an educational stipend and a housing stipend. Yeah, it's really, really great insurance. It's a Anthem Blue Cross, like PPO, and you'll have access to all of the great providers that are at UCLA. And then I just have some other photos of our residents having a great time. And yeah, so we can, I don't know if we'll have time for questions, but you can get more information about our program. We have a website, as well as this email address, uclarehab@gmail.com. Happy to answer any questions, and you can also follow us on Instagram.